All information and resources are based on the opinions of the host, unless otherwise noted. All information is intended to motivate, encourage, and inspire positive change and a healthier lifestyle. Now, this podcast contains some quotations, images, and excerpts from copyrighted material. These uses fall well within the copyright doctrine of fair use. Fair use refers to the right to reproduce, use, and share. And welcome, everybody, to the On One Radio. It's the talk show podcast station, and I'm bringing you daily health and information. So, this is Daily Health. Now, the coronavirus. There's a lot of upset about it. There's a lot going on with it. A lot of people are indeed getting sick from it. So not only is it affecting health and taking lives, it's pretty much damn near about to isolate everyone. Now, for those who kind of are some loners, they're not going to be hit so bad with it. But for those who are very sociable and like to go places, constantly doing things, you're at a higher risk for contracting it. Especially when it's what I call a very public place, like airports or even hospitals. I mean, places like that where there's a lot of different people coming and going and touching everything, and you're touching everything, and coughs and sneezing, you know the whole deal. Well, it's hit sports. We've got soccer, and they're trying to pretty much end the game for a moment. And this is Italian soccer. Now, their government is pressuring them to stop their games and everything like that because, again, like I say, in a very public and open place, you're going to run into people from everywhere, more than likely. So there's a lot of germs flying around and everything like that. You've got, this is going to affect football. I mean, it started in China. So it just kind of spread after that. It's hit the United States. I mean, even one of the CPAC attendees tested positive for it. So, I mean, it's not just in one place. And, I mean, it's a lot of confusion going on. And for some people, it's a panic. For some people, it's the end of the world. It's just life, to be honest about it, because before we were here, there were other people here that were affected with things that kind of dwindled the population. Now, is this some population control? I don't know. Who really knows? I don't know. What do you think? I mean, I know, and I've seen quite a bit of the little memes and things about not drinking Coronas and everything like that because it's the virus name. And for a lot of people, it's like kind of just a joke. Maybe it's to help them. That's the way they do. You know, everybody handles things very differently. And this is a scary topic. Let's just be honest about it. It's a scary topic, but at the same time, being a loner is not so bad because you're not ripping and running all the time and going everywhere. Now, Washington, their governor is weighing the idea of mandatory measures. And I mean, we can kind of understand how this going to kind of go that way because they're going to try and contain and slow it down and stop it, you know, pretty much all at the same time. I mean, you've got the health officials stating that the elderly and sick should limit their travel. Okay, that's reasonable. Now, the U.S. Surgeon General on the subject is being stated like it's contained in certain areas of the world. if it's spreading, it's not really contained. Now, I mean, if you just going by the state or the parish or county or whatever, maybe, maybe it's contained, maybe it's not. All it takes is a cough, a sneeze, or something like that. Now, I give I give Italy their props on what they're trying to do, because they're trying to lock down Milan, Venice, and more to contain the virus. And the U.S. cases have now passed 400. So yeah, it's happening. Now, to contain the virus, Italy will limit movement across much of its northern region, including the cities of Milan and Venice. The measures, the most drastic outside of China, place significant restrictions on 16 million people in a broad area that is Italy's economic engine. So yeah, it's affecting the money, and especially for people trying to go to work. Like, they don't have a choice; they're gonna lose their job if they don't go to work. So it's almost like weighing the risk: do I go to work or do I not go to work? Well, you're gonna have to go to work if you want a roof over your head and things like that. And it's almost like you're just gonna have to step out on faith when it comes to that. Now, it has been suggested that people wear masks. You know, um, we really don't know how well that's really going to work, seeing as this is basically a new strand of what we've already had. Yes, a new strand basically of what we already had. Now, the virus has continued to spread in the United States, with cases surpassing 400 and reaching more than 30 states, as well as Washington, D.C. Now, like I said before, an attendee for the CPAC, which is Conservative Political Action Conference, a major annual right-wing gathering held in Maryland in February and attended by President Trump and Vice President Pence. Now, that attendee tested positive for the virus. The host that organized said as the U.S. death toll rise to 19. Now, the White House is aware of the patient, and at the time there is no indication that either Trump or Pence met with or were in close proximity to the attendee. Now, that was via Press Secretary Stephanie Grisham. Now, we know there is a lot going on with the traveling, and a lot of people like taking cruises. Personally, I have never been on a cruise, and so I don't know what I'm missing, so I guess it really doesn't matter. But for those who do, you might want to slow down on your cruises until all this kind of blows over, at least. As sort of a preventive measure, because we've got these cruise ships where people are pretty much stranded. They're isolated, quarantined, whatever you want to call it, trying to keep them from being in contact with people who don't have it. That is going to be a battle. Now, Carnival Cruise Line officials stated that they had no clear indication of where the Grand Princess ship being held off California's coast was headed, as passengers and their families expressed frustration. Of course, they stuck on the damn ship. I can totally understand that. But at the same time, they're going to have to be as patient as possible. Now, Washington, D.C. reported its first presumptive positive case of the virus days after Maryland officials announced several cases. Virginia, Utah, and Kansas also announced their first positive cases. A Florida presidential forum hosted by the nation's largest federation of unions became the latest gathering to be canceled over the virus fears. More than 24 American tourists are being quarantined on a cruise ship in the Egyptian city of Luxor. Now, Health and Human Services Secretary Alex Azar defended the administration's testing procedures, which have been widely criticized after the initial CDC virus test kits were faulty, saying the only issue was just that manufacturing scale up for capacity. So basically, in other words, they're just pretty much saying they were trying to make money on the cool and just hurry up and rushing that shit out. Maybe without being tested to make sure that it actually works. I don't know how the testing for that would go, because I don't know. I don't work in the lab, so I don't know. But it does bring some doubt about this. Now, Carnival Cruise Line officials had no clear indication, but they said they had been in touch with federal and state officials as well as Port of San Francisco, but frustration, however, was mounting about uncertainties as to when the ship would dock and where, as well as what Carnival officials called a lack of an established testing regimen for passengers and crew members, 21 of whom have tested positive for the virus. 19 of the patients are employees. Now, they went on to say that their guests who expected to disembark still do not know what to expect next. And I know that it's got to be, that's got to be hard as hell. You're on a cruise ship, you're not in control of anything, so that would make the anxiety level go up and be kind of high. Now, Carnival Australia said on a conference call with reporters, passengers were dismayed about sparse information and the fact that they learned about positive tests for the virus through a Friday afternoon news conference. Now, they too were disappointed that we were not officially notified and could share that with the guests in advance of the announcement being made. So it makes you wonder about protocol and everything. So it's a lot. It's questionable. There's a lot of things that's questionable. But most oftentimes it is the emergency protocols that they have in place that they sometimes do not have in place or have not rehearsed it, or should I say practiced it, did drills, testing, or whatever the case may be. Every situation like this, every company, whether it's a cruise line, a hotel, a resort, I mean, whatever it is, they need to have safety, security, and health emergency protocols in place, have been rehearsed, practiced, and are active. Because to be stuck somewhere and not know what's going on when you went to this place for fun or to relax or whatever the case may be, you're not getting any information as to what the hell is going on. Of course you're going to be frustrated. And these employees been on this cruise ship, they're working around people they don't know. So of course, they're more than likely going to come into contact with it first. Because you don't exactly know how many trips they've made, where they've been, and things of that nature. So like I say, protocol is kind of everything on this. Now, so there's a lot of people that ask the question, really, what is it? What is the virus? We're going to get to that. But let's go to the people at the center of China's virus outbreak. They're kind of frustrated now as well because, of course, they've been on lockdown. Now, for days, several cities as the heart of China's deadly virus epidemic have not recorded any new infections. So residents have a message for the authorities. It's time to lift their quarantine. Now, you can understand people being on lockdown. You might go a little stir crazy. Now, so it's pretty much they've been under lockdown since late January. And that's as the government rushed to put a lid on a virus that first emerged in the regional capital, Wuhan. I mean, you've got people who haven't set foot out their house in 40 days or more. Like I said, that's frustrating. Now, as of Sunday, there were no new cases in the province for a third consecutive day, except in Wuhan, which recorded 41 fresh infections. It is the first time that has happened since daily figures were released in January. So for 12 consecutive days, there hasn't been any new cases. But they're still trying to, contain, make sure there is no more spread. And I know they probably feel kind of bad because it started there, but unless it's something that the government did there, you can't really feel too bad about it, because all you can do is what you can, keeping everyone, safe, healthy, and try to make them comfortable as possible in the situation. Because this is, shit, I'd have a headache. I would have a headache dealing with that. Now, there are some areas with no virus cases since the start of the outbreak. The situation has messed up a lot of plans, a couple of people have stated, but you gotta find a silver lining in it. Although your plans, kick it plans might have been put to bed for a moment, it's just postponed until things clear. So everyone in China, hang in there. Much love and respect go out to you all, to Italy, to everyone that's pretty much dealing with this and who've had to been quarantined or had lack of information or any of that. Now, more than 3,000 people have died. Over 80,600 have been infected in China. The vast majority of deaths and cases have been in Wuhan, where health officials believe the virus first appeared in a market that sold wild animals before spreading around the world. But the number of new cases has gradually fell for weeks. Following China's example, of course, we talked about Italy and their plan to put large parts of north of the country in lockdown to contain the spread of the new virus. China and other countries are demonstrating that spread of the virus can be slowed or even reversed through the implementation of robust containment and control activities. Now, the World Health Organization stated, as the global number of cases passed 100,000, that's a lot of cases. It stung me for a minute, y'all, because I feel kind of bad for those involved. Now, it's just one of those things to where if you limit a lot of going and going and going and going, then you can do like your own social quarantine or whatever the case may be, and then the government wouldn't have to implement it. But until then, if we just act like nothing's going on, then more than likely more and more people will start being quarantined, and that's not comfortable for anybody, and we know this. We know this. Now, so back to what it actually is. Because like I say, I've gotten messages about asking me, well, what the hell is it? What type of virus is it? What's going on? Well, I'm going to give you some official information on that so you can be aware and updated and have some semblance of a guidance according to what's going on. Now, the CDC is responding to an outbreak of respiratory disease caused by a new virus that was first detected in China and which has now been detected in almost 90 locations internationally, including the United States. The virus has been named SARS-CoV-2, and the disease it causes has been named Coronavirus Disease 2019, abbreviated COVID-19. Now, on January 30th, the International Health Regulations Emergency Committee of the World Health Organization declared the outbreak a public health emergency of international concern, which is true because that is exactly what it is. Now, on January 31st, 2020, Health and Human Services Secretary Alex M. Azar declared a public health emergency for the United States to aid the nation's healthcare community in responding to the virus. Okay? Now, the source and the spread of the virus are a large family of viruses that are common in people and many different species of animals, including camels, cats, cattle, and bats. Rarely, animal coronavirus can infect people and then spread between people, such as with what was called the MERS-CoV and SARS, basically SARS-CoV. And now with this new virus named SARS-CoV-2, it is a beta coronavirus like MERS and SARS. All three of these viruses have their origins in bats. The sequences from U.S. patients are similar to the one that China initially posted, suggesting a likely single recent emergence of the virus from an animal reservoir. So it sounds kind of like they were still kind of trying to figure it out and guess it and see what's going on. Did somebody get it from an animal and then it just started passing from people to people, or vice versa, or whatever the case may be. Now, early on, many of patients at the epicenter of the outbreak in Wuhan, Hubei province, China, had some link to a large seafood and live animal market, suggesting animal-to-person spread. Later, a growing number of patients reportedly did not have exposure to animal markets, indicating person-to-person spread. Now, person-to-person spread was subsequently reported outside Hubei and in countries outside of China, including in the United States. Now, some international destinations now have apparent community spread with the virus that causes COVID-19, as do some parts of the United States. Community spread means some people have been infected and it is not known how or where they became exposed. So that means we really do have to start kind of locking it down. Like, not too many unnecessary public functions and activities, unless we know for a fact everything is clear and ready and everything is back to somewhat normal. Hell, what is normal? Who knows? Now, the situation for us here in the U.S., in addition to CDC, many public health laboratories are now testing for the virus that causes COVID-19. With this increase in testing, now 19 states have reported cases of COVID-19 to the CDC. Now, U.S. virus cases include imported cases in travelers, cases among close contacts of a known case, community-acquired cases where the source of the infection is unknown. That's any public events, basically. Now, the illness severity level of it, the complete clinical picture with regard to COVID is not fully known. Reported illnesses have ranged from very mild, including some with no reported symptoms, to severe, including illnesses resulting in death. While information so far suggests that most COVID-19 illnesses is mild. Now, that's a report out of China, suggests serious illness occurs in 16% of cases. Older people and people of all ages with severe underlying health conditions like heart disease, lung disease, and diabetes, just for example, seem to be at a higher risk of developing serious illness. So then we have to look at risk assessment. I mean, what, the who, what, when, where. Well, that's the part that's going to be kind of difficult. Now, outbreaks of the virus infection among people are always of public health concern. The risk to the general public from these outbreaks depends on characteristics of the virus, including how well it spreads between people, the severity of resulting illness, and the medical or other measures available to control the impact of the virus. For example, vaccines or medications that can treat the illness. Huh. This disease has caused severe illness, including illness resulting in death, is concerning, especially since it has also shown sustained person-to-person spread in several places. These factors meet two of the criteria of a pandemic. As community spread is detected in more and more countries, the world moves closer toward meeting the third criteria: worldwide spread of the new virus, which is what we really do not want. So I'm asking everybody to try and do your risk assessment, um, and just really be careful, because we don't know how quickly this thing is going to spread any further, but we still have to have hope and believe that at some point it's going to, I don't want to say dry out, but that's kind of how I'm looking at that. Dry out, shrivel up, go away, hell, leave all my beautiful people alone. Now, the current risk assessment: for most people, the immediate risk of being exposed to the virus that causes the illness is thought to be low. This virus is not currently widespread in the United States. People in places where ongoing community spread of the virus that causes COVID-19 has been reported are at elevated risk of exposure, with increase in risk dependent on the location. So if you know is a house over here with 40 people in it, don't go to that house, because out of that 40, how many are infected? We don't want to live in fear, but at the same time, we do have to live in reality and be real with ourselves and others. Self-preservation is a motherfucker. We gotta have it. You gotta have it. You gotta protect yourself. You have to protect your children and family. And whatever needs to be done to accomplish that, well, it needs to be done. Now, travelers returning from affected international locations where community spread is occurring also are elevated risk of exposure, with increase in risk dependent on the location. Same deal. Now, the CDC has developed guidance to help in the risk assessment and management of people with potential exposure to the virus. Now, the CDC did respond pretty well. I think they kind of on the right path here. Now, their response was: global efforts at this time are focused concurrently on containing the spread and mitigating the impact of the virus. The federal government is working closely with state, local, tribal, and territorial partners, as well as public health partners, to respond to this public health threat. The public health response is multi-layered, with the goal of detecting and minimizing introductions of this virus in the United States. CDC is implementing all of its pandemic preparedness and response plans, working on multiple fronts to meet these goals, including specific measures to prepare communities to respond to local transmission of the virus that causes COVID-19. Now, there is an abundance of pandemic guidance developed in anticipation of an influenza pandemic that is being adapted for a potential COVID-19 pandemic. So, like I say, they're trying. They've established a COVID-19 incident management system. They activated its Emergency Operations Center to better provide ongoing support. And the U.S. government has taken unprecedented steps with respect to travel in response to the growing public health threat posed by this new virus. Now, the U.S. government suspended entry of foreign nationals who have been in China within the past 14 days, which by now is a little bit longer. U.S. citizens, residents, and their immediate family members who have been in Hubei province and other parts of mainland China are allowed to enter the United States, but they are subject to health monitoring and possible quarantine for up to 14 days. Now, the government announced it was suspending entry of foreign nationals once again. So they're going through their protocol, looks like. And that's a really good thing, because we need to have some type of something going on here so we can actually function and continue to live, because nobody wants to get sick. No, nobody wants to get sick. So, I mean, if you feel that, you may be sick, stay home except to get medical care. You should restrict activities outside your home except for getting medical care. If you cannot go to work, don't go to work, school, or public areas. Avoid using public transportation, ride sharing, or taxis. Separate yourself from other people and animals in your home. That's going to be a hard one. Just people as much as possible. That's pretty much what this is going to be. There's a tip about calling ahead before visiting your doctor. If you have a medical appointment, call the healthcare provider and tell them that you have or may have the COVID-19 virus. This will help the healthcare provider's office take steps to keep other people from getting infected or exposed, and help you by getting you treatment. And I say, if you need to, go ahead and wear a face mask. No shame in that. Now, if you have to cough and sneeze and you feel like you may, have something going on virus-wise, please cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in a lined trash can. Immediately wash your hands with soap and water for at least 20 seconds, or clean your hands with alcohol-based hand sanitizer that contains at least 60% of alcohol, covering all surfaces of your hand and rubbing them together until they feel dry. Soap and water should be used if hands are visibly dirty. Avoid sharing personal household items of any kind. Just of any kind. Monitor your symptoms. Keep a record of it. So that way, if you need to go to the doctor, you have a layout of when you had fevers, when, you felt this and that. That way, that helps get you the help that you need. But always, clean your hands often. When I say often, often. Every time you think about it, because think about how many doors we touch, how many keys we touch, how much money we touch. That's one of the nastiest things out there, and you come in contact with a person with those things who are infected, there you go. So, clean all high-touch surfaces every day. That includes counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables. Also, clean any surfaces that may have blood, stool, bodily fluid on them. Use a household cleaning spray or wipe according to the label instructions. Labels contain instructions for safe and effective use of the cleaning product, including precautions you should take when applying the product, such as wearing gloves and making sure you have good ventilation during the use of the product. I mean, that's just pretty much what that is. And like one of my friends will say, stop being so damn friendly. You ain't gotta hug everybody. You ain't gotta kiss everybody. Everybody need to hug and kiss on you. So we know this thing is pretty much going to be wrapped up and situated. Now, my heart goes out to all those who have been affected by this virus. We're praying that you and your family receives comfort, health care, and all the things that you need. So please, please. This virus is no joke. Don't be panicked. Don't live in fear. Just take precautions and be realistic about it. You have been listening to Daily Health on the On One Radio Talk Show podcast station, where daily health is viewed as an ever-changing reality, which we know it is. If you would like to get in contact with On One Radio, Daily Health, you can email on1radiotalk@gmail.com. Place it to the attention, please,